We just rolled out our in-home technology solution, Right Assist, which is powered by the company Paxana. And so this is a wellness bracelet that really enables us to provide the best possible care.
What happens when an AgeTech startup founder crosses over and starts working for one of the largest home care networks in the world? In this episode of the AgeTech Podcast, I'm joined by Bailey Paxton from Right at Home to talk about their new venture fund and what startups need to know if they want to partner with a franchise system. Bailey, welcome to the show.
Thank you, Keren. I'm really excited to be here.
Thank you. I'm very excited to have you with us today. Could you share a little bit about your background and your origin story and what brought you to your current role at Right at Home?
Yeah, absolutely. It's kind of a long story, but I've been really fortunate to be exposed to the industry from a ton of different angles. So I know, growing up, both my grandparents, like many others, suffered from Alzheimer's and dementia. And so that was kind of the first exposure to the industry. And then when I was in high school, my parents went through this process of, I want to buy a company or I want to start one. And so they looked at a bunch of businesses. We talked about different things. And then, they ended up buying a few of these right at home franchises. So I got to see them kind of build these businesses from the ground up. And I got to work in the business as well. So I grew up working as a caregiver, part of the office staff and everything in between. So, in the early days when a caregiver would call off in the middle of the night, I would have to go or my brothers would have to go. And, it's all hands on deck, which I absolutely loved. And so that really kind of got me into the industry. And then when I was at Michigan State, I was always very interested in entrepreneurship and innovation. And so, in my classes and different programs, they always teach you to look for different shark bite problems. And so it's funny because, every time I'd go back home on the weekends, my parents were always complaining about scheduling and staffing and, somebody calling off and, not having someone to kind of fill in for a client or, it not being a good fit. And so I was like, okay, mom and dad, I'm going to do something about it. So I went through, I did a startup weekend with some friends, and then we tried to build this company around scheduling and staffing for home care agencies. And so that kind of started off as smart staffing and then later evolved to agile care. But we raised some money, we built a product, and then, ultimately shut down. And I think the biggest challenge was, first of all, getting access to these existing ERP software systems, and then also really understanding the users, buyers, and payers and how they all kind of work together in the industry. But, either way, I learned a lot from the process. And then, really kind of, I got connected with you and many other kind of industry leaders and took a ton of great exposure. And then, fast forward a couple of years, I was actually recruited by the Right at Home corporate team to come help build out the innovation team. So now I've been with the corporate team for the past few years. And then, it's been a fantastic experience.
It is quite a unique career path that you have. And today you basically are running Right at Home's newly funded or founded corporate venture arm. Is that correct?
Yeah, yep, absolutely. So we actually just launched the fund earlier this year. We got the approval from the board back in December to take $5 million off the balance sheet and invest in, seed stage. It's funny. So, when you start a venture fund, it's very similar to starting a startup and you learn so much as you go. And so, over the past few months, the thesis has, changed and kind of evolved and adapted. But yeah, so we're investing in startups enabling the future of aging at home. So AgeTech, B2B SaaS, operational software. But any of these companies that really solve a need for the industry that we can leverage our, 25 years of industry expertise and 600 locations. So super excited, but we'll do seed up to kind of Series A, and then, pre-seed as well. But check size ranging between, 100,000 and 300,000. So we're not really competing with other funds, but we are a fantastic strategic value add for the right companies.
Absolutely. And in terms of sort of the problems you are looking that startups are solving, are those specific problems that you've seen at Right at Home? So you're looking, let's say, for companies who do scheduling, payroll, and billing.
Yeah, great question. So, I think at this point we're really open to kind of what's out there. I'm pretty focused right now in some of these operational tools. So like you're saying, kind of the scheduling, kind of the, billing piece, that there's so much opportunity to really improve our operations and really go from, good to great. And so looking at these different technologies and figuring out where they fit. And so it's interesting, back earlier this year, I actually went through this venture embedding strategy where basically I spent a month in San Francisco, a month in Boston, and a month in New York, meeting with, different venture funds, different ecosystems, and really trying to get a good idea of, what are the technologies out there and how could they fit into our business. And so that's been super beneficial. But, looking at these technologies now that I have a good understanding and trying to bring them back into the business, whether they're venture investable or not, because they'll still benefit the business overall.
Absolutely. That's amazing. So this operational part of home care is something that I personally am very curious about, because right around the time when you started Agile Care Solutions, we had a bunch of other tech-enabled home care software companies popping up. I think ClearCare was the one that got acquired. And we had a bunch of other software solutions dealing with the operational side of home care. And it seems to me that home care today in 2025 is very different than what it was 15 or 20 years ago. So it's no longer a pen and paper type of business, but it's a computerized, software-driven type of business. Where do you still see opportunity to innovate on the operations side in this day and age?
Yeah, super great question. I think there's opportunities to innovate in almost every aspect of our business, from kind of recruiting to client engagement to the scheduling piece, HR. I mean, there's so much opportunity, especially with all the technologies that we have. And I think, a big thing for us, it's, how do we become more efficient? And then how do we really go all in on that kind of local marketing and then that local relationships that, things that computers can do.
Right at Home works on the franchise system. Is that correct?
Yeah. And so I'm happy to talk a little bit more about, Right at Home as a whole. So we're, a large home care franchise system. So we provide companionship, personal care services, a little bit of skilled nursing, but very minimal. We're in 46 states, 5 countries. We have 600 locations across the US and then another 200 globally. And then we'll see, over 20,000 clients on any given day.
So these 600 locations, most of them are owned and operated by franchisees?
By franchisees, yep.
And the individual franchisees, do they use their own software, or does headquarters say, hey, we're going to switch to this software now. You have 12 months to deploy it on your sites, and we're going to streamline operations so everyone is using the same software in the back end?
Yeah, so really great questions. And so there are some things that we require, and then others are up to their own discretion. So, basically they're all individually owned and operated businesses. But, through the franchise agreement, there's a few softwares that we do mandate. And so that's, WellSky Personal Care, which is the main operational tool. We have QuickBooks, and then we have another tool called ZWise, which is how we can track everything on the back end. Everything else is pretty much up to that individual franchisee. And then what we'll do is we'll have preferred partnerships where, just the business owners are really focused on operating their business and running the day-to-day operations and kind of growing in that way. And then, at corporate, we're able to kind of focus on a lot of the national marketing, businesses best practices, and do much of the R&D that's required. And so the franchisees lean on us for that. And so we try and find the best vendors to have preferred partnerships with, and then we'll kind of go about it that way. But we can't require them to adopt a certain solution. There really has to be kind of an incentive for them, or they really have to understand the value of that solution.
So this sort of leads me to my next question. When you're looking for preferred vendors to partner with, how does the selection process go? Specifically, if we're talking about any type of technology that you are looking to bring into the organization.
Yeah, that's a great question. And so it really kind of depends on the type of technology, because it does differ a little bit if it's, a caregiver engagement tool versus, an operational tool, or kind of a more traditional AgeTech solution. But really what we like to see at the corporate level is, obviously we need to understand kind of the problem they're solving, how the solution, does it actually address the solution? And then, the HIPAA compliance, it's all kind of table stakes at this point. But once that's kind of met, we really like to see these tools working with a number of home care agencies. And if somebody's earlier and they really solve a need, we're open to that. But really, we like to see you working with a handful of customers. And then at that point, we'll depending on the traction, we'll work with that vendor to, test out in some of our company-owned locations or some of our more innovative franchisees and really test and validate that ROI. From there, once we've kind of decided that, hey, this is a approved vendor, we do want to move forward with them, then we have Takeoff Tuesdays where, every week we'll meet with the whole system. We'll give them the opportunity to present to the network. We have our National Owners Conference and then another bunch of other kind of vehicles to kind of push out. But, again, we really have to kind of show the value because it's not, we're not mandating anything.
Absolutely. So this makes a lot of sense, testing with company-owned locations and then with some innovative franchisees. How do you see the bell curve of technology adoption around your 600 or 800 actually locations? Do you see that there are always those who are right, like on the front lines wanting to try out new stuff, and then you have a small percentage of sort of the laggards who are just waiting to see what everyone else adopts, what is the preferred vendor that most of the other locations are selecting, and then they will partner with that vendor?
Oh, absolutely. I think it's a perfect case study on that innovation curve. We spend a lot of time thinking about that. We have a good idea roughly of where all of our franchisees kind of fit on that.
Brilliant. And do you have any examples for solutions that you are super proud of in terms of how they were deployed throughout the franchise? Any specific solutions that you ran a pilot with and you saw good ROI, and then you saw hundreds of locations adopt?
Yeah, no, that's a great question. So, there's two that are in the earlier path right now. One company that we're really excited about that we've been working with for probably the past year and a half, 2 years is Caribou Care. And they're a caregiver rewards platform. And so basically, if you pick up a shift, we can send you points, which you can use to redeem for gift cards. It also tracks the employee referral process. So if you're a caregiver and you post one of our jobs on Facebook, you get a point. If one of your friends applies, you get more points, and then so on until they, pick up shifts and, have kind of 30, 60, 90-day retention. So it's been a fantastic tool for us. So we kind of introduced them to the system, I want to say 2 years ago. We did a 6-month pilot and then have really been kind of rolling out for the past, 6 to 9 months. But so they're at 75 offices today. Another tool that we're rolling out. So we just rolled out our in-home technology solution, Right Assist, which is powered by the company Paxana. And so this is a wellness bracelet that really enables us to provide the best possible care. So, it's a wearable. It lets us see kind of sleep, gait speed, activity levels, time spent in and out of the home. So this has kind of gone through the full innovation process of, I looked at, close to 100 companies in the space. We did an RFP with 12 vendors, and we narrowed it down to 3, and then we piloted for 6 months across, 10 or so offices. And then we actually rolled out the solution or launch back in May. And so we went from, a handful of offices to now we're coming on close to 40. So it's not a quick process. Everybody thinks that, you can just turn the lights on and, immediately everybody adopts it. But, you really have to have those initial case studies, then more people will kind of jump on. And then you have performance groups where, owners are communicating and talking about what's working for them. And so, the adoption isn't always as fast as, startups want to see when they're doing their initial business planning.
Thank you for sharing those examples. I think it's fascinating that you highlighted these two because, first of all, Caribou Rewards is one of the most interesting startups that I've seen in the past few years in terms of the problem they are addressing. And I wonder, one of the top challenges you hear home care owners and operators talk about is staffing, basically. Everyone is short-staffed. We know that there is a significant, very significant turnover rate industry-wide. How do you measure the ROI from a solution like Caribou Rewards, are you able to see turnover reduced in the specific locations that adopt this solution?
Yes, and there's a couple ways to measure it. Because so retention, if you try and measure employee retention, it's really hard to do. What you can do is get 30, 60, 90-day turnover rates before and after adopting a solution. And so that gives you a good idea, but it's still not perfect. So you kind of have to look at other KPIs to look for that ROI. So another example is like a cost per hire. So if we know, cost per hire is usually X dollars, and, Caribou Care can do it for like $297 or $197 per caregiver. That's a kind of good business case for us.
Wow. So there are multiple metrics that you track in order to show ROI for each of these solutions. Is that correct?
Yeah.
And in terms of the business model, what type of business model do you see that franchisees are more open to? Because I assume that in the case of Caribou Rewards, they have to spend some money out of pocket in order to see that ROI. And for other solutions, maybe there's a rev share model where they offer the solution, the technology to the end user, so the care recipient, and they buy it, and then there's some rev share. What do you see that works?
Yeah, so really kind of that per caregiver per month is what seems to work. It's tougher on the per client per month basis. We've seen, a number of kind of age tech startups come into this space. And the reality is running a home care business is hard. There's a lot of things going into it. You have, people calling off. There's a lot to manage. And so we're really good at, providing care and selling care and getting into the home and, having that kind of really, emotional kind of crucial conversation with the family and with that client. But it's really, really hard to pull technology into that. And then it kind of can take away from actually providing that care and kind of, doing that job that's required to be done in that moment. And so it can be a challenge to try and push some of these technologies up at that time or even at a later date. Obviously we want to be a resource for them, but, it's tough because, things work for the caregiver engagement per caregiver per month or per client per month, but it's just more difficult. And so you really have to be kind of strategic. I haven't seen revenue share business models work successfully yet. If you know of any, I'd be happy to learn more, but I just haven't really witnessed that to date. So it's really something you have to be creative in. Our owners are very price sensitive as well. So, there's kind of a range, what makes sense for that a business owner is willing to adopt.
Absolutely. So this sort of leads me to my next question. What do you know today that you wish you would have known in 2017, 18, 19, when you were running Agile Care Solutions? What if you could get a time machine and go whisper something in Bailey's ear, young Bailey, what would you say to him?
Yeah, so I think one of the things that I wish I knew was really the importance of understanding all of the industry stakeholders and what kind of motivates them and how to communicate to them. 'Cause you can kind of understand the different pieces of the puzzle, but communicating in this business is so hard. So if you think about if we want to roll out a new solution to the system, we have a good kind of voice to the franchisees, but from there, it's kind of a telephone game, right? So they have to, not only do we have to get the franchisee on board, but they have to get their office staff on board, who then has to go in, whether it's communicating that to the caregivers or to the clients. It's so important. And it's a very kind of complicated, the telephone game it's very complicated very quickly. So, I mean, that's something I would really kind of, advise myself is to just spend a lot of time really understanding and then understanding the motivations and how it all works together. And then understanding, the business model that fits into that.
Absolutely. That is solid advice. So would you recommend to any up and coming entrepreneurs to really go and spend some time and interview all the different stakeholders in order to really refine the value proposition for each and every stakeholder so they can give that to corporate or to the franchisee on a silver platter so they don't have to try to think for themselves? how to convey the message?
Yeah, absolutely. And I would also really advise these companies not to build up just a point solution, but a more robust program. So, we don't just want one piece of the puzzle. It's, how can we wrap around this kind of comprehensive, program that we could then offer to our clients and really give that on a silver platter to these business owners? Because a lot of times these franchisees, of course, you have the innovators who are willing to kind of work and tweak and figure things out. But a lot of times they don't have enough time to do that job for you. And that's kind of your job as the entrepreneur is to build this kind of robust, attractive program that makes sense for you. It makes sense for the business owner. And then it also makes sense to the client and their family.
Absolutely. Because at the end of the day, you have to have either the client willing to try or adopt a solution, or the office staff or the caregiver. So you always have multiple stakeholders. And that's what sort of makes it's so challenging, I think, to build in this ecosystem because you have multiple stakeholders to make happy. What do you do when there's sometimes a misalignment of motivations between the different stakeholders? How do you solve that?
I mean, Karen, that's the $1 million question. I mean, it's really hard. And, I know this, from being on kind of the other side of the table and starting a business, these things look so good on paper. So, I mean, that's something I would really kind of, advise myself is to just spend a lot of time really understanding and then understanding the motivations and how it all works together. And then understanding, the business model that fits into that.
So that sort of leads me to my next question. Right now, in the position that you're sitting in right now, and you're going to New York and San Francisco and Boston and looking for new solutions, are there any specific challenges you wish you would find a solution for, but you haven't seen any companies solving for that yet?
I think a big one, I'm really excited about the application of all these AI tools, whether it's kind of like the operation kind of scheduling piece, whether it's, following up and communicating with the caregivers, office staff, clients, really to give the best possible experience. And so I'm excited about combination of these tools and not just solving one issue at a time, but really stringing these tools together to have a more robust offering. There's a lot of fantastic tools out there that, we could bring into the consultation that'll listen and take notes and then fill out that care plan. There's tools that will listen into different conversations and kind of transcribe and provide feedback for that office staff. There's tools that'll do different pieces of the puzzle, but I'm really looking forward to being able to combine these tools together in a concurrent way that doesn't require the office to have 10 different platforms just to manage them all.
So if I understand you correctly, you would love to see an AI solution that sort of helps with intake, with building a care plan, and also maybe then transcribing what the caregiver says that they did during their shift to feed that back into your back office software?
Yeah, absolutely. That, and then, on the caregiver recruiting piece, something that could kind of manage the, application process, recruiting, application, kind of that whole process of filling out all the forms, and then, working through that engagement, and then really giving our staff the opportunity to kind of build those relationships and spend time building those relationships instead of kind of doing the manual follow-up of, isn't somebody's insurance out of date?
That is such a fantastic point, and it comes up in so many of my conversations. The fact that we have now these AI tools that could do a lot of the busy work, it really can help the humans who work in this industry, which, like, everyone I meet always say that they come to this industry because they want to work with people. No one says they want to sit in front of the computer 9 hours a day typing. So we now finally have the tools that could help us delegate that work, the busy work, to AI and leave it to the humans to do what you just exactly described, to build those relationships with the clients and to provide that tailored hands-on care that everyone wants at the end of the day. Everyone wants to be seen as a human, not just as a shift that needs to be filled.
No, absolutely.
What has been from your viewpoint, what has been the perception of these AI tools or the emergence of AI in general in the industry? What is the conversation like when you have like your national conference? What are people saying? Are they excited to be adopting some of these tools, or do they want to sit it out and see what happens, what the regulatory landscape looks like, and maybe in a year or two?
Really great question. I think, it does follow that standard innovation curve. So we have a ton of offices that are ready, willing to adopt, willing to kind of test and see because they know that this is the future. And so we do have a lot of excitement, a lot of appetite from the system to test and adopt these solutions. And I think the difference between, now and the dot-com boom is, the dot-com boom, you could afford to wait, right? Like if you didn't have a website, you were still probably going to be okay. I think the problem is with these AI solutions, it's happening so fast. And if you don't start to adopt these things now and start to learn and start to adapt your business, you will be left behind and you can't afford to wait. And so I think we have a bunch of very smart business owners who recognize that and they're willing to begin to test and adopt these solutions. So, we're already testing and adopting things at the corporate level. We have a bunch of franchisees that are testing a number of different tools. So the appetite is huge. There's a ton of opportunity. So if you're building in this space, we absolutely would love to talk to you.
That is awesome. And that was actually my last question. Is there anything that we didn't talk about that you would like to add? Any call to action to people in the audience?
Yeah, no, absolutely. I mean, if you have a company in the space that you think kind of meets the criteria or solves a need for the home care industry, I'm happy to chat. And then, if you're another fund or investor in the space, we do want to co-invest. So we have a lot of strategic value add, and we're the experts in the space. So we want to work together and super collaborative. So.
Awesome. That is a fantastic note to end with. Bailey, thank you so much for joining me on the show today. It was an absolute pleasure chatting with you and learning from your vast experience in the industry.
Thank you so much, Karen. I appreciate it.
If you enjoyed this conversation, there's another one YouTube things you might like right here. Until next time, stay humble, stay curious.